Hi everyone, it's Dr. Dan here at Harrisburg Joint and Muscle, and today I wanted to cover stretching out the pectoral muscle group. So there's a lot of misinformation. Yesterday I actually did a quick Google search after I had planned this, and it was amazing to me how many people were having arguments about various stretches that can be performed on the pectoral muscles. So I kind of wanted to get into our thought process on what stretches we recommend to people that maybe we haven't diagnosed, that we haven't had in office to actually assess, and then patients that are potential patients, let's say, that would be asking us for a recommendation for a pec stretch. So you can see that I have tape here on my shirt. So this was just a really good way to visualize the different fibers of the pec muscles. So obviously, you know where the pectoral region is, basically in here. What's happening is the pec originates here in the chest and then comes out and then starts to neck down right over here to the shoulder. And then obviously the motion that the pec performs is coming from here and bringing your arm forward like that. That's the contraction. If you do that at home, you'll feel this muscle contract if you have your hand on it. So with stretches with the pec, you can actually target, it's kind of a difficult muscle. You can't target the whole thing with any one stretch. You have to change the position of the arm to target each fiber. So the nice part about having the tape here, and you can actually, I'll show you how to do it at home to kind of show yourself what fibers you're actually addressing at any given time. With the tape on, basically what you want to do is to stretch each fiber. So we'll call this the upper, middle, and lower fibers here. So in order to target each set of fibers, basically what you want to do is you want your arm to line up with this line. So for instance, if I wanted to target the lower fibers, my arm would have to be up here higher. If I'm going to target the middle fibers, and they should line up, unfortunately the shirt doesn't do a very good job of that, but if I want to target the middle fibers, your arm is basically at 90 degrees to your body, and then also 90 degrees, actually 180 degrees to your chest. So it would be straight out. And then to target the upper fibers, it's just dropping your arm down just a little bit, right like that, and then stretching back. So the stretch that a lot of people are recommended for at home is a doorway stretch. I don't prefer to give people recommendations for a doorway stretch unless I've assessed them. And that means also having them here in office to also show them the stretch and see how it feels to them to do it while they're here in office to send them home to do it. So I'll get into why the doorway stretch can be kind of problematic, but first I want to show how I would recommend, and actually how I normally stretch my pec. I don't prefer the doorway stretch because it can get kind of uncomfortable. Actually, right before that, I do want to cover, this stretch is very good. We've covered a lot of upper cross syndrome symptoms, and we've covered a lot of different stretches to combat the postural changes that you undergo whenever you're sitting at work and things like that. So this stretch is fantastic am I kind of lined up there on the side, Dr. Rochelle? Mm-hmm. Okay. So if you have rounded shoulders, right, like that, so again, the shoulders are coming forward, that means that this muscle is probably pretty tight. Again, because that motion of bringing the arm forward is the action of the muscle, the rounded shoulders are a lot of times partially caused by the fact that the pecs are tight. So that's a good way to figure out if it would be a good stretch for you. So I love foam rollers for this stretch. And the reason being, you can actually just do a body weight stretch. And if you've ever done a doorway stretch and compare it to how a body weight stretch feels, you'll find it feels very similar. And it actually can be a kind of aggressive stretch. You can also add in a little bit of a small weight, like a 2-pound weight to a 5-pound weight if you're not getting a good stretch. And for those of you that have ever lifted before, you know that if you've done flies on any upper body day, and maybe it's been a while since you've done them and you're stiff and sore, doing almost a reverse fly, so starting from here and then letting your arms fall back whenever you have weights, it feels good and it gets your chest stretched out. So that's the same concept that we're trying to accomplish here. So the foam roller can either be across, it can actually go from the bottom of your low back up to the top of your mid back, or I like to actually have the foam roller behind me and then rest my head on it. The foam roller is just to keep you up off the floor and allow your arms to fall out to the side, give you that space. So I'd lay back on the foam roller, basically to here. Oh, now I don't even have it positioned right. There we go. So my head's resting on the foam roller. So again, to target the upper fibers are going to be the lower arm position. So all I'm going to do is I'm going to bring my arm out to that position and then just let it fall straight back like that. And the key is here, try to keep your shoulder, everything up here, your shoulder into your neck, try to keep that as relaxed as possible. You don't want your shoulder to be coming to your ear like that. you just want to let your arm gently fall out to the side and let that stretch. And for me, the upper fiber stretch actually doesn't feel all that intense. Now the middle fiber stretch, where my arm is out to the side, this is where it gets more intense. And you should be feeling a stretch right across this area. It's okay if your elbow starts to feel a bit of a stretch too, but you can also just bring your elbow in, and then that also locks the motion into just the shoulder as well. So you can also do that. And then again, for the lower fibers, you're going to be reaching up and out, and that's the most aggressive stretch for me right there. And I'm feeling the stretch all the way across here. And again, if you wanted to, if you needed a more aggressive stretch, you can always add a small weight, even like lighter household items. You can just hold that in the hand and let your arm fall out to the side, and that will accomplish a bit of a more aggressive stretch. Now, at home, obviously you have this video to reference, so if you want to come back and look at the video to see the tape lines that I've drawn and see, again, corresponding to you, see what you're looking at in terms of fibers. The other way that you can do it too is you can either take your hand or somebody else's hand, and acting like your wrist is the shoulder and where the pectoral muscles neck down, you can take that, basically hold it at the shoulder, and you see how my fingers almost recreate the fiber directions just about perfectly. So again, lower fibers, higher arm position, middle fibers straight out to the side, and then upper fibers down an arm position just a little bit below that 90-degree line. So that's the stretch that I normally do for it. Now, the reason that I don't recommend the doorway stretch is because when you so we'll just do the middle fibers for right now because that's the most common one. Most times people don't recommend either doing a lower one or a higher one. It's generally just a general one for the middle. Whenever I start to do this and I lean into that doorway, and I'm not keeping proper foot position for right now, but actually I should be staggered a bit. But whenever I'm doing this, I feel a decent stretch across my chest, but what I'm feeling is I'm feeling pinching kind of in the back of my shoulder here. And that's something that you don't want to feel. You don't want to feel the shoulder joint itself pinching, which is where the body weight makes it a lot easier because it's just the weight of your shoulder pulling on the chest and everything else is relaxed across your shoulder. So you can try either one, but if you have been having pinching in the shoulder and you at one time were recommended that pec stretch with the doorway, try the body weight one, say with a foam roller. It's a phenomenal way to do it. And you obviously don't need to have the foam roller on a bed or anything. On the floor is just fine. It's just to give that little bit of separation between you and the floor to give your shoulders the range of motion that they need to fall out to the side. That's about it. But like I said, online you'll see a lot of videos that are saying never do the doorway stretch, and I'm not even really sure what the credentials are of the people that are saying that, so take it with a grain of salt. But again, in office, I will have people with very tight chests where even this stretch, just a mild stretch is enough to elicit that stretch across the chest. And in that case, I'm perfectly comfortable with prescribing that, but that's also asking them how the shoulder is feeling and also instructing them to stop it if there's any pinching in the shoulder. With that being said, here in office, you might be kind of wondering, well, why do I need them if I learned how to stretch my pec out on my own? The biggest thing is if there are specific fibers that need to be targeted, that's what we do with muscle work. So we basically take the same motion that I'm using in that stretch and we're targeting the individual fibers where maybe there's adhesions, maybe there's a trigger point, maybe there's just some taut fibers in there. And we can actually target it, and with our assessment of the range of motion, we can get it to the exact angle of the shoulder where we can target that specific muscle and get the stretch directly there. So that's always a good reason to come in. The other thing is, like I've said in a lot of videos, you're going to hear me say it in just about every video, diagnosis is key. So tight chest a lot of times includes tight mid-back. There's also, again, if you go back to the upper cross syndrome video that I did, it also can cause symptoms in the neck. So it's good to get the whole, if you want to call it a unit, that's involved in upper cross syndrome. It's good to get all of that addressed and all of that looked at. And again, diagnosis is key because there's a lot of different things that can mimic a tight pectoral muscle. Pain in the chest is not simple, and it can be caused by a lot of different things if that's what you're experiencing. So with that, I think I'll wrap it up. This was a more brief video than we've done in the past, so I hope you guys appreciate that. And thank you guys for watching. As always, you can contact us on Facebook. Feel free to comment in the video. You can always message us on Facebook, call us at 717-999-4347, or book online at our website. If you don't like talking to anybody or you don't want to hear my voice anymore, that's perfectly fine. So I hope you guys are having a great Tuesday and have a good rest of your week.